Hello, everyone. It is our pleasure to present to you our patient-centered initiative that addresses a need and gap in care of post-sepsis patients. Kristen and I are both sepsis survivors who've experienced sepsis and post-sepsis syndrome symptoms. Our lived experience and involvement with other sepsis survivors was the driver behind the development of this educational, resource-directed tool for patients and healthcare providers. Next slide, please. The Action on Sepsis Research Cluster is a group of researchers, health professionals, policymakers, and patient partners tackling the complex issue of sepsis prevention, diagnosis, management, and long-term care across the human lifespan. It works with partners in BC and globally, including the BC Sepsis Network. The BC Sepsis Network was created in 2012 by the BC Patient Safety and Quality Council to connect physicians and nurses in every emergency department in the province who could champion sepsis improvement locally. The Action on Sepsis Patient Advisory Council, of which Kristen and I are both members, is a group of dedicated sepsis survivors who have a keen interest in patient-oriented research and bridging the connection between academia and the public. We see the value of lived experience in the advancement of healthcare, advocacy, teaching, and research, and use this experience to support and inform the cluster's activities. Next slide, please. Sepsis is the body having a severe reaction to an infection of any source. This triggers a chain reaction of events that leads to a widespread inflammatory response, leading to organ damage. If not treated and resolved, it will lead to death. In spite of Canada having developing early recognition protocols and treatments, we still have people dying from sepsis. Poorer countries globally have much higher rates in adults, and sadly, often too many in children. The impacts of COVID on these statistics is yet to be seen, as severe COVID is sepsis. Next slide, please. Sepsis survivors have an increased chance of rehospitalization and death. Those that recover are often left with debilitating symptoms and issues related to the 4 pillars shown in the diagram. Ongoing immunosuppression and changes increase the risk for reinfection. There are neurological impacts, cardiovascular issues, and changes that diminish quality of life for many. Many of these overlap what is seen in post-ICU syndrome and now in long haulers who have had COVID. Next slide, please. Briefly, I'm a septic shock survivor times 4 years now. I suffered complications following a routine laparoscopic surgery. Multiple abdominal abscesses rapidly occurred, and within 48 hours, I was diagnosed with septic shock, acute kidney injury, and heart failure that initially required ICU care times 5 days. A host of complications developed, leading to a transfer of care to an even higher level hospital. In total, I spent 58 days hospitalized. You can read more about my acute experience on our website. I'm here to share what was my post-sepsis experience and why this project means so much to me and my fellow sepsis survivors. On a side note, I also bring in unique perspective as a retired RN who never heard of post-sepsis syndrome, and neither had any of my colleagues that I had known over the years. As you can see, I had to deal with a variety of symptoms related to the previous 4 mentioned pillars. Neurologically, I have pronounced neuropathy in my feet and no longer feel my toes. I have experienced memory issues and difficulty with concentration. The latter were catalysts in my decision to retire early as a nursing manager. It took about 5 months to overcome the severe fatigue and muscle weakness, and upward of a year or more to fully recover from these issues. I still have ongoing insomnia related more to PTSD that causes fatigue on some given days. Fortunately, all of my respiratory issues resolved, but I am prone to respiratory infections due to damage in my lungs. You may think hair loss is insignificant, but trust me, after all that happened, it was upsetting. It was like, now I'm going to lose my hair. I was diagnosed with PTSD with the onset of COVID, and the fear of infection from it triggered a significant psychological and depressive response, of which I'm still being treated for. I've been able to manage some of these fears as time progressed, but that fear of getting seriously ill again never completely goes away. The long-term impact it has on loved ones is something few people think about. My sister basically put her life in Prince Edward Island on hold for 5 months to care for me, as my husband had to work and I could not manage activities of daily living alone. There are also financial, social, and mental health impacts for survivors and family. My family and closest friends still worry and become anxious anytime I am ill. During my hospitalization, sepsis was never mentioned, nor was I told that what had happened was septic shock. I was simply told I had a bad infection. My family didn't know what questions to ask, and I was too sick to ask questions. But being a nurse, I eventually figured it out. I myself was unaware of post-sepsis syndrome and symptoms that I could experience, and that they could be long-term and my recovery could be very prolonged because of them. My family's physician was very supportive, but he too had no knowledge about post-sepsis syndrome and welcomed any information I provided to him. Eventually, I found amazing support and information from other sepsis survivors on social media. This led me to doing my own research and subsequently connections that led me to being a patient advisor for the research cluster in 2019. The researchers have and are continuing to work at better understanding of not only sepsis, but post-sepsis syndrome as well. This is exciting and gives hope to many. Sadly, many sepsis survivors are not believed and or supported by their healthcare professionals due to a lack of evidence-based research validating their symptoms and ongoing issues. It's now my pleasure to pass you on to Kristen. Next slide.
Thank you, Sue. My sepsis experience is not too dissimilar to that of Sue's. In my case, it was a laparoscopic cholecystectomy or gallbladder surgery in May 2016. That was the start of my sepsis journey. I ended up returning to hospital via ambulance about 30 hours later after my surgery in severe pain and respiratory distress. I was diagnosed as being in septic shock, the culprit being a bowel perforation acquired during the initial surgery that necessitated the removal of over 10 centimeters of necrotic tissue. I required 2 additional surgeries to repair my bowel, resulting in a stay in the ICU, 11 days of which were in a coma, and later in the surgical trauma unit for a total of 21 days altogether in hospital. I lost over 11 kilograms. I ended up with an abdominal abscess that took weeks to clear, and I was required to wear a wound vac in my abdomen for an additional 2 months. I ended up with cellulitis around the uppermost part of my incision, only a few weeks of being discharged from hospital. And the 21 centimeter long incision in my abdomen took an additional 6 months to heal, as it just simply would not close up in the area around my diaphragm. With any subsequent illnesses or even minor injuries over the past 5+ years comes a lurking fear of sepsis. And although I've not had sepsis again, the long-term effects for me have been life-altering, even with the passage of all this time. My new normal of ongoing side effects includes loss of senses of taste and smell, with only my sense of smell really coming back fully, which is a bit of a holdup in my moonlighting as a career as a food historian and food writer. As you can see from this particular slide that's up right now, I have a few ongoing side effects, which include exhaustion, insomnia, bone and joint pain, digestive issues such as bile acid malabsorption, unexplained fevers, anxiety, PTSD, and on and on. I have a scar on my right arm from the restraints I had to wear in the ICU due to ICU psychosis whilst in my coma. And I also still have a bald spot on the back of my head from the same problem, from the same issue. I still have difficulty swallowing. And I have frequent laryngitis related to having been intubated and re-intubated, which is a very vivid flashback memory that is not been helped by the respiratory distress stories of the pandemic. Because I was, this occurred when I was removed from the BiPAP machine too soon into my ICU stay. And then finally, there was no post-hospital rehabilitation program, so I undertook a program of self-funded physiotherapy for another 24 months at great personal expense. And although my fantastic GP did her best to fill in the blanks and it was very supportive, there simply wasn't a lot of information out there about post-sepsis or just a lot of sepsis information out there. With these ongoing post-sepsis syndrome, or post-sepsis symptoms that I've been experiencing, I then began to trawl the internet for any reliable resources on sepsis to better understand what was happening to me. Thankfully, I found communities online and later on the Action on Sepsis Research Cluster group. And although my sepsis and post-sepsis experiences are unique, they are not uncommon. If nothing else, it has encouraged me to speak out to help others in order to encourage better outcomes for those with sepsis and their families, as well as for those treating it. This is why it's been my honor and privilege to participate in the development of this informational pamphlet for those affected by sepsis to provide resources and support to those who need it. Next slide, please, Stephanie. As I noted in my sepsis story, it is extraordinarily important to have some sort of informational literature to explain the complexities of sepsis and post-sepsis syndrome to patients, as well as their families and caregivers. Through several iterations of the pamphlet that has been amended, it includes now side effects to watch out for and resources for additional healthcare support. During the development of this pamphlet, we identified where the gaps were between lived experience, evidence, and clinical practice, with the goal of making resources and programs more accessible and more understandable for a better recovery process on the part of patients. Next slide, please. This has been a multi-phase project, first of which involved collaborative work between the Action on Sepsis Patient Advisory Council and the BC Sepsis Network to develop a draft pamphlet, We reviewed the pamphlet through virtual interviews with sepsis survivors and health professionals to assess the appropriateness, accuracy, and potential impact of a resource such as this. Each interview was 30 to 60 minutes in length, and the pamphlet was revised based upon that feedback and later shared with the interviewees that participated in the initial stages of the pamphlet. Next slide, please. Participant recruitment for this project was conducted via a direct email campaign. Participants were purposely chosen based on their known lived experience as adult sepsis survivors or as health professionals involved in sepsis or post-sepsis care for adults. These interviews were conducted over Zoom by the Action on Sepsis Research Cluster Coordinator following an interview script. Each interview, as we said earlier, was 30 to 60 minutes in length. And the next two slides provide an overview of the pamphlet so far. Pardon me. So the findings of these initial interviews were used to refine the overall design and content of the pamphlet. For example, this is the first page of the original draft. As you can see, this is the prototype from the slide. If we could go to that of the updated version, which has come since then. Stephanie, if we've got it. In general, the order of the content was reorganized and the language simplified to be more targeted towards patients recently discharged from hospital. Additional material was added on the mental and emotional impacts of sepsis was added, and further information on local organizations and services able to provide links to health professionals for post-discharge support and care was also added. And so you can see that last slide. Okay. And then I'll next send you to Sue, who will discuss the next steps and where we're planning to go with this project. Okay. So our next steps then. Further engagement is needed to ensure the information is appropriate and will reflect supports available for individuals from marginalized communities. We also acknowledge that robust knowledge translation is needed to ensure that pamphlet has the intended effect. It is planned to target and disseminate the information to healthcare professionals, sepsis survivors, and their caregivers. And we so far have decided this can be achieved either online through educational webinars and the distribution of the pamphlet to patients and or caregivers during their hospitalization or discharge procedure. There will be passive dissemination of the information to sepsis survivors and caregivers through social media platforms and sepsis websites. And finally, there are intentions to initiate a small pilot study, although that is still to be decided, how and when, to disseminate and evaluate the effectiveness of the pamphlet for health professionals, patients, and their caregivers. Next slide, please. This pamphlet project relies on our partners, and we gratefully acknowledge the support and participation of them. The first of which is Action on Sepsis through its engaging social media campaigns and patient-centered sepsis podcasts, which we just launched this month, February 2022, with more to come. You can listen to these podcasts at sepsis.ubc.ca/podcast. We also thank the Canadian Sepsis Foundation, which brings its broad audience of sepsis survivors to this project. We also thank the BC Sepsis Network, which hosts educational webinars targeted to health professionals, with further plans to collaborate with our health authorities to support future dissemination of the pamphlet through their online patient educational materials, resource collections, and continuing education events. We thank you for your time and interest, and we now have time for a few questions.